Hi everybody, today I'm gonna talk a little bit about mucous membrane pemphigoid. Okay, so first of all I'm gonna start with our case. For patient demographics, the patient is 49 years old female. Now this patient came to the clinic and her chief complained that she was reporting a sore mouth of 8 months duration. The discomfort consistently involves the gingiva and buccal mucosa. Blisters have been observed on the buccal mucosa. The patient reports soreness of the left eye 5 months ago. This was treated with an unknown ointment, resulting in improvement. For the patient medical history, the patient reports hypertension treated with SARAPES and occasional arthritis in the left shoulder treated with aspirin. The patient previously used minipress for hypertension, but this indication caused xerostomia and a sore throat. The patient has had a cholecystectomy, which is gallbladder removal, because of gallstones and varicose veins stripped. For her dental history, the patient had numerous teeth extracted due to caries. Her last dental visit was approximately 1 year ago for adjustment of partial dentures. The patient has used maxillary and mandibular RBDs for 10 years. She doesn't wear her partial dentures at night. She has difficulty wearing her partial dentures because they irritate her gingiva. She has difficulty brushing her teeth because of her gingival discomfort. This is the first picture of her labial gingiva of the patient. This is a close-up of her labial gingiva. Then we have a maxillary anterior lingual gingiva picture, as we can see here. Also we have a close-up of her maxillary anterior lingual gingiva, mandibular lingual gingiva, and finally mandibular lingual gingiva again, right buccal mucosa, and as we can see there is ulceration. Her left buccal mucosa with ulceration. So our clinical findings from these pictures, ulcerations are present at buccal mucosa, attached gingiva, and attached alveolar mucosa. The ulcerations are mildly compressible, tender and fixed to surface mucosa and underlying structures. Nikolsky's sign is present. Cervical lymphadenopathy and skin lesions are not present. For the summary of what we have seen in our clinical findings, it is a chronic persistent vesicular ulcerated erythematous disease which involves multiple areas of oral mucosa. Our differential diagnosis was lesions to include in our differential diagnosis was likely planus, pemphigus, mucous membrane pemphigoid, and lupus erythematous. Okay, for our investigations, biochemical investigations such as complete blood count, liver function test, blood sugar estimation revealed values within a normal range. A perilesional biopsy was performed at left lower labial mucosa and histopathology revealed hyperkeratinoid stratified squamous epithelium of variable thickness with subepithelial split. Basal cell degeneration in a few areas. The underlying connective tissue stroma showed inflammatory cell infiltrate, few eosinophils, and vascularity. The clinical and histopathological features favor a final diagnosis of mucous membrane pemphigoid. So our final diagnosis was mucous membrane pemphigoid. Okay, now I'm gonna talk a little bit about the management that we did for this patient. The patient was advised to maintain a good oral hygiene. Also, the patient was prescribed topical application of high-potent steroid clobetasol propionate. The patient was instructed to apply the cream thrice a day for 2 weeks over the ulcer and retain it for about 30 minutes, after which she could wash her mouth. Tablet betamethasone 0.5 mg was powdered mixed with water and used as a mouthwash twice daily for 10 days. Vitamin E supplements, lycopene, once daily was prescribed for 1 month, and the patient was reviewed every 2 weeks for the first month. The lesions improved considerably with topical steroids within 4 weeks of starting the treatment. I'm going to talk a little about mucous membrane pemphigoid. Mucous membrane pemphigoid is a group of rare chronic autoimmune disorders characterized by blistering lesions that primarily affect the various mucous membranes of the body. The mucous membranes of the mouth and eyes are mostly affected. What are the symptoms? We have oral symptoms and we have systemic symptoms for MMP. The oral symptoms are blisters form first on the gums, near the teeth, palate, tongue, lips, buccal mucosa, floor of the mouth and throat may be affected. Painful erosions and ulcers makes it difficult to eat. So we are going to notice weight loss for the patient. Also blisters on skin develop in 25 to 30 of patients. Conjunctivitis and may lead to impaired vision or blindness. Management. Evidence from 2 small randomized controlled trials indicates that ocular mucous membrane pemphigoid responds best to cyclophosphamide, while mild to moderate disease seems effectively suppressed by treatment with dapsone. Rituximab is a therapeutic option for refractory cases, and this is the end of my presentation. Thank you, and please stay safe at your homes. Thank you.